Imagine you're renovating an old house. You know, you can put up some new wallpaper, add a fresh coat of paint.
Maybe change out the hardware on the kitchen cabinets.
Exactly. And, I mean, that makes things look better for a little while, right?
Mm-hmm.
But what happens when the foundation itself is sinking?
Yeah, when the structural beams inside the walls are actually starting to rot.
Right. A fresh coat of paint just isn't going to save the house. If you want it to stand strong for another 50 years, you don't paint it.
No, you bring in the bulldozers.
You completely demolish it down to the studs, and you force a massive rebuild from the ground up. So, welcome to another deep dive.
Thanks. I'm excited for this one.
Today, we are taking you into the fascinating, highly effective, and honestly, sometimes brutal world of skin resurfacing and tissue renewal.
It really is a world where controlled destruction is the ultimate catalyst for biological youth.
It sounds like an oxymoron, but it's true.
It is, and the clinical data and medical protocols we're analyzing today map out exactly how this works. We've got a stack of sources, including medical guidelines from the NHS, private clinic protocols from Dr. H. Consult and Sue Aesthetics,
As well as comparative analyses of cosmetic technologies from LOC Cosmetic and the London Clinic.
Right, and we're going to show you how thermal trauma can erase deep facial scars and even treat severe intimate menopausal symptoms.
Yeah, we are going to uncover why the absolute most effective treatments in modern dermatology often require you to, well, look like an actual monster before you get to see a miracle.
It's the ultimate, it gets worse before it gets better scenario.
Seriously. So the mission for this deep dive is to unpack the biology of that destruction. And I think we have to start with the root cause of why people seek these extreme treatments out in the first place.
Yeah, the trigger.
Right. And for a huge portion of the population, that trigger is menopause.
Absolutely. Because to understand the skin's deterioration, you really have to understand hormones.
Which is where the data from the Boulder Medical Center comes in.
Yeah, that source highlights that the skin is practically an endocrine organ. It is just densely packed with estrogen receptors.
And estrogen is, it's basically the fundamental fuel, right?
Exactly. It's the fuel that keeps your cellular machinery churning out collagen, hydration, and elastin.
But when menopause hits, that fuel line is severed. The Boulder Medical Center source points out this truly staggering statistic.
Oh, the 30% drop.
Yeah. Women can lose up to 30% of their skin's collagen content in just the first 5 years of menopause.
30% in 5 years is just a catastrophic structural collapse.
It is. Think of your skin's collagen like the metal springs inside a mattress.
Okay, I like that analogy.
If you suddenly reach in and, rip out a third of those springs,
Yeah?
the surface of that mattress is inevitably going to start sagging.
Yeah, it loses its bounce.
Right, the fabric on top thins out, and it just stops snapping back into place when you press on it.
And unfortunately, it's a mattress you can't just flip over.
No, you definitely can't. And that rapid decline, that collagen cliff, is what drives people to seek out interventions.
Which brings us to the massive industry of non-surgical technology designed to fix this sagging mattress.
Right, looking at the comparative analyses from the LLC Cosmetic and London Clinic sources, we have the usual suspects of medical aesthetics.
Right, things like microneedling.
Yeah, which creates those tiny physical punctures to stimulate healing. Or HIFU, sending sound waves deep into the tissue to lift the jowls.
There's also radiofrequency, using heat to gradually tighten the skin.
And PICO lasers, using ultra-short light pulses to shatter sunspots. I mean, they all have their place, right?
They absolutely do, but they are the fresh coat of paint in your house renovation analogy.
Oh, interesting. So they aren't the bulldozer.
No, they rely on gently coaxing the skin into repairing itself, which means they have hard limits.
So what happens when you hit those limits?
Well, when you're dealing with severe, deep smoker's lines around the mouth or deep pitted acne scars that look like craters in the tissue, coaxing doesn't work anymore.
The skin's architecture is just too far gone.
Exactly. You need the nuclear option. You need the CO2 laser.
The heavyweight champion.
Right. Because unlike microneedling or radiofrequency, the CO2 laser doesn't gently heat the skin or prick it with needles.
So what does it actually do?
It uses highly concentrated light energy to literally vaporize the damaged layers of skin. It turns solid human tissue into a plume of smoke.
Which sounds absolutely terrifying.
I mean, it sounds like a horror movie.
Yeah.
But the biology of why vaporizing the skin works so well is fascinating. When you inflict that level of sudden, massive thermal trauma, you completely bypass the body's normal, sluggish maintenance mode.
You're forcing the biological emergency repair system into absolute overdrive.
Exactly. The body panics. But in that panic, it floods the area with brand new, highly organized type 3 collagen.
Okay, let's pause there because I want to make sure we understand the mechanism here. What exactly is type 3 collagen, and why does the highly organized part matter?
Good question.
Because usually when I think of massive tissue trauma, I think of a scar. And a scar is raised and bumpy.
Right, and that's the crucial distinction. Typical adult skin is primarily made of type 1 collagen.
Okay.
When you get a normal cut, the body rushes to patch the hole quickly, so it dumps down collagen in a chaotic, jumbled mess. That's a visible scar.
It's just trying to close the wound as fast as possible.
Exactly. But massive, uniform thermal trauma tricks the tissue into reverting to a fetal healing state.
A fetal healing state.
Wow. Type 3 collagen is often called the youth collagen. It's what babies have in abundance.
Oh, so that's why baby skin is so soft.
Right. The body lays this type 3 collagen down in a smooth, highly organized lattice structure, so it doesn't form a raised scar.
It forms a perfectly smooth, brand new layer of baby soft skin.
Precisely.
Okay, so we're moving past the gentle maintenance and into the brutal reality of what the sources call fully ablative CO2 laser resurfacing.
And looking at the protocol from Dr. H. Consult, this is where the deep dive gets really intense.
Yeah, because fully ablative is not a lunchtime procedure where you go back to the office looking a little flushed.
No, fully ablative means the laser removes the entire outer layer of the skin.
The epidermis.
Yes, completely. Every single cell of that protective barrier is gone.
Yeah.
You are left with a raw, denuded dermal surface.
And the recovery for this is a solid 14-day downtime.
At least.
The description in the Dr. H protocol paints a very vivid, very gruesome picture for you. I mean, patients wake up feeling a severe, intense sunburn sensation.
And their faces swell up dramatically.
Right. And because the protective outer layer of skin is just missing, the body starts oozing a yellowish cerulous fluid.
Yeah, that fluid is actually a natural, necessary part of the wound healing cascade.
Really? It sounds like an infection.
It looks like one, but it's not. It's blood serum leaking from the raw tissue, carrying white blood cells and specialized proteins to the surface to fight infection.
But then as it hits the air, it crystallizes, right?
Exactly. It forms heavy, thick, yellow crusts all over the face. And the protocol is incredibly strict here.
You cannot pick those crusts off.
Absolutely not. If you pull them prematurely, you rip out the delicate new cells forming underneath, guaranteeing a permanent scar. You just have to let them shed naturally.
Okay, here's where I had a massive aha moment reading through this protocol. And it felt like a huge contradiction to everything we are ever taught about skincare.
The SPF rule.
Yes. Literally every dermatologist on earth preaches the gospel of daily SPF. Wear your sunscreen, rain or shine.
Right.
But Dr. H's protocol strictly,
Yeah.
emphatically forbids the use of sunscreen for the first month after this procedure.
It seems crazy, doesn't it?
It does. Why on earth would you expose brand new, vulnerable, laser-burned skin to the sun without SPF?
Think about the physical barrier that's missing. The epidermis, that shield that keeps the outside world out, has been vaporized.
Okay.
Sunscreens are packed with complex chemical filters and physical blockers like zinc oxide. They are formulated to sit safely on top of an intact epidermis. If you apply sunscreen to a face that has no epidermis, those harsh chemicals sink straight into the raw, exposed dermal tissue.
Oh, wow. So you're putting chemicals directly into the bloodstream and raw tissue.
And the body reacts violently. It causes a severe, incredibly painful inflammatory reaction called contact irritant dermatitis.
So you're basically chemically burning a severe thermal burn.
Exactly. It can ruin the entire procedure. So instead of sunscreen, patients are instructed to rely on absolute, strict sun avoidance.
Like locking yourself indoors.
Yeah, keep the blinds drawn. And to protect the face from the air and bacteria, you have to cover it constantly in a thick layer of plain Vaseline or Aquaphor.
You're manually applying an artificial barrier.
Right. The Vaseline acts as an occlusive layer. It traps the body's moisture inside so the cells don't desiccate and die.
And it keeps environmental bacteria out until the skin can finally regrow its own epidermis.
Which leads to another very modern detail in the protocol. Patients are strictly forbidden from wearing face masks, like the COVID masks we all got used to for a full 3 months post-procedure.
3 months. Why is that?
This comes down to mechanical trauma. The newly formed skin is incredibly fragile.
Oh, I see.
Yeah, the constant micro-friction of a mask rubbing against the cheeks and the bridge of the nose creates chronic low-grade inflammation.
And inflammation is the enemy of organized healing.
Exactly. Over time, that constant rubbing confuses the healing process. Instead of laying down that smooth lattice of type 3 collagen we talked about, the inflammation triggers the formation of cicatricial scarring.
Which presents as a permanent, raised, web-like pattern etched right into the face wherever the mask touched.
It's devastating.
The stakes are just incredibly high. I mean, this isn't a beauty treatment. This is a serious medical trauma that you are opting into.
It really is.
And when we look at the universal protocols from Succulent Ethics and the NHS guidelines, the preparation alone is a major undertaking. You are basically priming the canvas for destruction.
Yeah, the pre-care is intense.
The NHS guidelines dictate that patients must stop taking oral retinoids, like Accutane, a full 6 months prior to the laser. Why 6 months?
Because Accutane fundamentally alters the architecture of your skin. It works by aggressively shrinking the sebaceous glands, the oil glands.
Okay, that makes sense for treating acne.
Right, but those glands are actually where your epithelial stem cells live.
Oh, wow.
Yeah, they're the very stem cells that migrate up to heal a burn. So if you vaporize the skin while those glands are shrunken and depleted from Accutane, you have no stem cell reserves left to regenerate the tissue.
The skin simply forgets how to heal.
Exactly, leaving you with permanent, catastrophic scarring.
That is terrifying. You
Yeah.
also have to stop all topical acids and retinols weeks in advance to ensure the skin barrier is completely calm.
And the post-care is just as intense.
Yeah, you're sleeping elevated on a tower of pillows with a clean towel over them because of the oozing and the massive swelling.
Yeah.
You're using bags of frozen peas for the intense burning.
But there is a massive caveat here regarding who can actually get this treatment safely.
Right. Let's talk about that.
The medical standard used to determine safety is the Fitzpatrick scale, which categorizes skin based on melanin content and sun reactivity.
And according to the sources, CO2 lasers are generally considered safest for Fitzpatrick types I through 3, so lighter skin tones.
Yes.
I'm looking at this Fitzpatrick scale constraint, and I honestly don't fully understand the mechanics. It seems like melanin is the deciding factor, but why would heat cause pigment cells to react differently than the rest of the skin? I mean, heat is heat, right?
Heat is heat, but melanocytes, the cells that produce pigment, are highly reactive defense mechanisms.
Okay.
Their entire job is to deploy melanin to protect the skin from damage, usually UV damage. In darker skin tones, those melanocytes are highly active and robust.
So when the CO2 laser hits them,
When it inflicts that massive thermal trauma, the melanocytes panic. They don't know it's a controlled medical procedure. They just sense catastrophic injury.
where they just think you're under attack.
Exactly. So they try to protect the tissue by pumping out a massive overload of pigment. This results in post-inflammatory hyperpigmentation.
Meaning the skin heals from the burn, but it heals much, much darker in the treated areas.
Exactly.
Is it an absolute deal breaker for darker skin tones, or are there mitigation strategies?
Doctors will often prescribe specialized medical-grade skin bleaching creams like hydroquinone for a full month prior to the procedure.
Oh, to prep the skin.
Right. The goal is to chemically suppress those melanocytes, essentially knocking them out or putting them to sleep so they don't mount that massive defense when the laser hits.
But even with chemical suppression, the risk remains incredibly high, right?
Very high.
And hyperpigmentation isn't the only weird risk here.
Yeah.
The sources list some truly bizarre complications. There's hypopigmentation, which is the exact opposite.
Yeah, hypopigmentation is tricky. If the laser penetrates a millimeter too deeply or the thermal energy spreads too far into the surrounding tissue, it can literally incinerate the melanocytes.
Oh, it kills them.
They die off completely. So when the skin heals, it heals completely white, permanently devoid of any pigment at all.
Wow. And then there's the one that really made me shudder. Ectropion.
Ah, yes, ectropion.
That's what that.
This happens when the laser is used around the delicate skin of the lower eyelids. Remember, the thermal energy shrinks and tightens the tissue. That's the goal for treating wrinkles.
Right.
But if the doctor uses a setting that is even slightly too aggressive, the skin shrinks too much. It becomes so tight that it physically pulls the lower eyelid down and inside out.
Inside out.
Yes, the inner pink mucosa of the eyelid is permanently exposed to the air, and the patient physically cannot close their eye.
Oh my God, how do you even fix that?
It requires complex reconstructive skin graft surgery to fix.
It just highlights how this is a game of millimeters and precise degrees of heat.
Oh,
You are walking a razor-thin line between a miracle and a disaster.
you really are.
But that razor-thin line of thermal damage is playing out on faces everywhere. And the data from our MDPI clinical study takes this exact same violent mechanism to a part of the body people rarely talk about.
Which connects perfectly back to our earlier point. because that menopausal estrogen drop doesn't stop at the jawline.
No, it affects the entire body. And one of the most profound silent impacts is a condition called Genitourinary Syndrome of Menopause, or GSM.
GSM affects up to 70% of postmenopausal women.
That's a huge number.
It is. Because of the loss of estrogen fuel, the vaginal mucosa, the internal lining of the tissue, becomes incredibly thin, fragile, and dry.
And the symptoms are severe. It leads to severe itching, a high risk of chronic urinary tract infections.
And intercourse becomes incredibly painful, if not entirely impossible.
Right. So researchers in this MDPI clinical study looked at 125 perimenopausal women suffering from severe GSM.
And this is where it gets really interesting. Instead of putting them on systemic hormone replacement therapy, which comes with its own complex risks, they used a CO2 laser directly on the vaginal mucosa.
Wait, hold on. We just spent 10 minutes talking about how this laser turns facial tissue to oozing crusts, requires a month of Vaseline, and causes massive swelling.
I know what you're thinking.
Applying that to the vaginal mucosa sounds absolutely barbaric. How is the recovery not a complete nightmare?
It's a vital distinction in the technology. For the face, we discussed fully ablative resurfacing, which vaporizes 100% of the surface area.
Okay.
For the vaginal mucosa, they use a fractional CO2 laser. The laser beam is actually split into hundreds of microscopic columns.
So it's not vaporizing the whole surface?
No. It drills tiny thermal holes deep into the tissue, but crucially, it leaves bridges of completely healthy, untouched tissue in between every single hole.
Oh, so the healthy tissue acts as like a rapid response team.
Precisely. The healthy cells migrate instantly into the microscopic wounds, accelerating the healing process dramatically.
Okay, that makes so much more sense.
Yeah, you get the thermal panic, but without the oozing crusts and the 14-day downtime, the mechanism of action still relies on waking up the dormant fibroblasts.
Let's define the fibroblasts quickly, connecting back to our mattress analogy earlier.
Sure.
If the collagen strands are the springs, the fibroblasts are the tiny cellular machines working on the assembly line, constantly manufacturing new springs.
Then without estrogen, those manufacturing machines go dormant.
They just shut down.
Right. So the thermal impact of the fractional laser blasts into the atrophic thinning tissue. The heat shock wakes the fibroblasts up.
It forces them back to work.
Exactly. It forces them to generate brand new collagen and elastin. And crucially, it promotes angiogenesis.
Angiogenesis.
Right.
Which is the creation of entirely new blood vessel networks, right?
Yes.
I want to give you an analogy for this because visualizing what's happening inside the tissue really makes the data click.
Go for it.
Think about a dying brown lawn in the middle of summer. The soil is hard as a rock. You can water it all day, but the water just runs off the surface. It can't penetrate.
Okay, I see where you're going.
Using this fractional laser is like bringing in a core aerator. You are punching hundreds of tiny controlled holes deep into the compacted earth.
You're causing damage.
Yeah, exactly. But suddenly, oxygen can get in. Blood flow, the water and nutrients can finally penetrate the deeper layers of the tissue. You are forcing the ecosystem to regenerate itself from the inside out.
That ecosystem regeneration is exactly what the data shows. The tissue plumps up, thickens, and regains its natural hydration entirely without the use of added hormones.
Let's look at the specific data from the study, starting with the environment. The vaginal pH.
This part is fascinating. Before the laser, the women had an average pH of 5.61.
And a high pH in that environment is dangerous, right? It encourages bad bacterial growth and chronic infections.
Exactly. 6 weeks after the laser treatments, the pH dropped to a healthy, acidic 4.69.
And the biology behind that pH drop isn't just magic. When the laser restores the mature, healthy cells to the surface, those mature cells contain a sugar called glycogen. The good bacteria in the vaginal microbiome, the lactobacilli, feed on that glycogen. As they digest it, they produce lactic acid.
That acid is what drives the pH down, physically transforming the environment into a hostile zone for infections.
It's such a brilliant biological chain reaction.
It really is. And the study measured that exact cellular health transformation using the Vaginal Maturation Index, or VMI.
Basically looking at the cells under a microscope.
Yes. Before the treatment, only 2.1% of the cells were healthy, mature, superficial cells. The rest were thin, immature cells struggling to survive without estrogen.
And after?
6 weeks post-treatment, those mature, glycogen-rich superficial cells jumped to 8.9%. The tissue was literally maturing and thickening.
But the metric that really matters is the quality of life. The study used the Female Sexual Function Index, the FSFI, which scores pain, arousal, and satisfaction.
Right. The baseline score for these women was a dismal 12.79 out of a possible 36. But at the 6-week mark, that score nearly doubled, leaping to 24.39. For many of these women, it meant the return of pain-free intimacy and a massive improvement in daily comfort.
That's life-changing. But nothing lasts forever, though. The study followed these women out to 12 months.
Right. And while their scores at 12 months were still significantly better than before they started, the benefits did peak at that 6-week mark and slowly trended downward over the year.
Because you haven't cured menopause. The estrogen fuel line is still cut.
Exactly. You've just forced a massive tissue remodeling. Because the underlying hormonal deficit remains, patients will likely need ongoing maintenance booster sessions.
Like every 6 to 12 months.
Yeah, just to keep the fibroblasts active and the ecosystem functioning.
That makes total sense. Let's zoom out and summarize the journey we've been on today.
It's been a ride.
It has. Whether you are looking in the mirror at the 30% menopausal collagen cliff on your face, or you are silently suffering from the invisible, painful reality of genitourinary syndrome of menopause, the biology remains the same.
The CA2 laser proves a profound biological truth. Sometimes the only way to build back stronger is to willingly undergo a period of intense, highly controlled destruction.
It's a fascinating paradox to use massive physical trauma as an instrument of healing.
It really is. And I want to leave you with a final thought to ponder, looking ahead at where this science is taking us.
Ooh, okay. What is it?
Well, right now, extreme physical trauma is the only way we know how to kickstart this massive biological youth cascade. But what happens when regenerative medicine finally isolates the exact chemical distress, signals those vaporized cells release?
Wait, are you saying...
Will we one day be able to synthesize the panic of a third-degree burn, injecting the signal directly into the tissue to reap all the regenerative miracles without ever actually firing a laser or breaking the skin?
Oh, wow. That is a wild thought. Just completely bypassing the bulldozer entirely and sending the blueprints directly to the cells.
Imagine that.
But until then, whether you are trying to restore intimacy or erase the map of the years from your face, sometimes you really do have to bring in the heavy machinery. You have to demolish the old foundation if you want to build something new. Thanks for joining us, and we'll see you on the next deep dive.